If an inverted, I read on your website that in some cases after surgery for inverted nipple correction, the nipple can go back and the surgery will need to be repeated. In this case, would the second surgery be free or will I have to pay for another surgery? It'll be free. So if it goes back within a reasonable period of time, and I'm sure we've got a time scale on it, I think it's 6 or 12 months, I'm not sure. But within a reasonable period of time, as long as they're not sort of a second pathology, you have other children, and you breastfeed and things, because these things can cause fibrosis of the glands, of the ducts. And we said that if you've had an inverted nipple correction, you probably wouldn't be able to breastfeed, so that would probably be a moot argument. Yeah, absolutely. I mean, I think one of the things about the clinic, and one of the things that I always say to people who say, you know, perhaps there's cheaper places to have procedures, we do focus heavily on the aftercare. And if it's not right, whether that means your inverted nipple inverts, or your mole still got a bump there, or a dent, or things aren't quite right, we will not charge you to fix it. We will fix it free of charge. And it is something to kind of be aware of with an inverted nipple correction, because it is not an unusual complication. It's not a usual complication. I mean, we always plan to get it so that it's a permanent solution. But one of the risks of inverted nipple correction is that it can invert again. It can pull in again. And by all means, we will do it again. The problem with these things is you're often dealing with scar, and there can be the law of diminishing returns if it goes in and in. And I have had patients where it's gone in again. Yep, do it, no problem, fine. It goes in again. Do I do it again? Do I do it a second time revision? Probably did. And then it goes in again. And every time you're doing surgery, you're getting more scar. So I always say to people, look, we will do everything we can to give you the best result possible. Sometimes the best result possible may not be as good as you would want. You know, it may not be 100% fully out. There might be that bit of tethering still there. And we, you know, I'm not saying everybody, but sometimes you get in these situations where you're fighting that scar tissue. And every time we do surgery, every time we do anything to anyone, we're causing scar. So, you know, you're fighting scar with scar. So it's very hard when you're desperate to have a happy patient. But, you know, sometimes when there's just a lot of scar tissue beneath that nipple, it just keeps on scarring and pulling down. You know, it's like there's not that much you can do. Sometimes it's just a risk with inverted nipple, but certainly we will do everything we can to make it come out again. And if we feel that doing another revision, doing another pull out, eversion procedure is right for you, we would not charge you for that, and as long as it's not like 5 years later or something. Yeah, as I say, it's one of the things that I try and kind of build the clinic on, the looking after you, and no hassle, no quibble with revisions and stuff. Look, there's a problem, we'll just get it right. And I'd rather sort of maybe charge a little bit extra at the front end to really look after people once they come through. And yes, we probably do lose people who will go elsewhere, and I understand that, but we're all about giving a really good service to the people that we do treat. That's kind of what we're after, what we're about.